5 weird sexual problems you must be concerned about. Some people may associate the term sexual disorders with sexually transmitted illnesses or other biological-related issues, but we're addressing the stigma linked to sex and defining sexual disorders as well as the effects they can have on your life. In order to better equip you with the knowledge you need to take care of yourself, let's discuss a few rare sexual problems. Number 1. Hypoactive sexual drive. That means a lot, perhaps even more than is necessary or less than is typical. Hypoactive sexual drive is having very little interest in having sex. This is how healthy and normal sex changes as people age. It's common for things to slow down and for them to be a phase when having sex isn't a top priority, but there is still some activity going on. If you ignore hypoactive sexual desire, which is when the lack of interest lasts for a long time and produces concern, it can strain and possibly ruin your romantic relationship. The good news is that there is a treatment for hypoactive sexual desire. Speaking with a healthcare provider can help determine what is causing it. Hypoactive sexual desire is an absence of sexual interest, not a momentary feeling. Therefore, if someone has met their partner but still feels hot and bothered, looking at a firefighter calendar is not hypoactive sexual desire. Number 2. Post-orgasmic sickness syndrome. Think of it as an allergy for those who produce semen. It is an autoimmune illness that affects allergy season. Going outside is a miserable ordeal if you don't have access to an antihistamine. Similar circumstances apply to post-orgasmic sickness syndrome. Soon after finishing sex, flu-like symptoms begin. If you have post-orgasmic sickness syndrome, your body reacts to the expelled semen like bacteria to make you sick, and symptoms appear almost every time. Those flu-like symptoms are an immunological response. After an orgasm, it may continue for up to a week. Post-orgasmic sickness syndrome is incurable, but you can manage the symptoms by cleaning up the area after a sex session. Adequate symptom dampening medication usage, with a doctor's approval, may also be a suitable course of treatment. Number 3. Sexual resistance disorder. Although more intense, it is related to hypoactive sexual drive. Based on the underlying causes, sexual resistance disorder has many classifications. It may be minor or severe, and as awful as it may sound, it transforms the meth into active anxiety of sex, which is active avoidance of all sexual contact with their partner. As a subtype of hypoactive sexual drive, the same therapies can be used. Number 4. Coital sphagia. You probably already know what's typical to experience following an orgasm: positive emotions like relaxation, warmth, and occasionally lightness, but this afterglow element isn't typical. Unfortunately, despite how bizarre it may sound, sphagia during sex is simply an intense orgasm that gives you a migraine. But unlike the sort of stress you're imaging, sex does in fact produce stress. When you orgasm, a significant amount of oxytocin and dopamine are released into your blood, which is why it feels so fantastic and can occasionally make you feel incredibly intense, similar to the kind that results from spending too much time at the office. Even if your hormones drop after a sexual encounter, emotions still have an impact on your body. High levels of oxytocin, such as those released after an orgasm, can restrict your blood vessels and eventually raise your blood pressure, which will result in a headache. Coital sphagia typically affects men, but it can also happen to women. Although it can be frightening because the headaches come on suddenly, coital sphagia is not fatal, and treatment can be as simple as taking regular migraine medication and exercising to lower the risk of vasoconstriction during physical activity. Number 5. Retrograde ejaculation. Semen runs the opposite way when you ejaculate retrograde. Crazy, huh? There is no connection between it with gravity or ocean waves. Simply said, your sphincter is the cause of the semen slowing backwards. A muscle called sphincter, which is found near the neck of the bladder, contracts during coitus to act much like traffic control by keeping your semen from mixing with other fluids. Under normal conditions, it prevents sperm from passing through the urethra and vas deferens before entering the penis and stops flow in the bladder lane. The sphincter stops after the retroactive ejaculation, and everything is left to work things out on its own. The sperm travels where it pleases before landing in the bladder. Since the sphincter is on vacation and those muscles aren't closing, semen will go up the neck of the bladder, which is shorter and less dangerous, even though it doesn't affect your ability to experience pleasure. If you and your partner are attempting to conceive, it might be very awkward. A significant issue: speak with your doctor to come up with a solution. We all would benefit much from having more sex, which is a beautiful thing. Should have a better understanding of it, if only detect when our health is being damaged. Medical practitioners have various answers to your inquiries. Thus, seek out and learn more about this wonderful aspect of life. Please share your thoughts with us in the comments. Thank you for watching the video. Be sure to like and subscribe to the channel.